It's nice to be here and speak with you again. I was here just yesterday speaking on ADHD, and there will be a video of it, a DVD available in case anybody wants that. This is what I'll be speaking about today, talking about inflammation. How does it occur? What happens when there is an inflammatory process? How to detect it via blood tests and other tests, and what we can do to both prevent and to treat it. So we're going to talk a little bit about diet as well as supplementation. Inflammation is a complex series of chemical and cellular activities performed by the body in response to usually an injury or some kind of abnormal stimulation caused by a physical, chemical, or biological agent. Inflammation is triggered whenever body tissues are injured, and the process of inflammation prevents the spread of the damaging agents. It disposes of cell debris, and it sets the stage for tissue repair in order to restore the tissues to their original state, if possible. And inflammation is the body's first action towards healing itself, so inflammation itself is a natural process. Chronic, daily, subclinical, invisible inflammation sustained over a lifetime is the underlying cause of aging. And that is not only a theory, but it's pretty much well ingrained fact. This means that aging and disease can be slowed, and some forms may even be prevented if you can control chronic inflammation. This one says, one day you look in the mirror and realize the face you are shaving is your father's. How many have had that experience? A few. There are basically two types of inflammation, acute and chronic. With the acute inflammation, it's usually localized, intense, usually of short duration, minutes to days, and usually rapid in response, with neutrophils as being the primary cells that get involved. With chronic inflammation, it occurs when it's usually triggered if the acute phase isn't effective. It can be low intensity, it can be of long duration, days to a lifetime, and the accumulation of macrophages and lymphocytes usually leads to tissue destruction. Inflammation is a hidden cause of aging and disease. Research on the dangers of systemic inflammation is still not widely recognized. It is the primary risk for all cancers, Alzheimer's, and heart disease. Many of you have thought in the past that the most important thing in controlling heart disease or preventing heart disease is to control your cholesterol levels. Well, that is really not the only thing that you should look at. I think far more important is controlling inflammation. And lab testing will reveal some of these inflammatory markers. Oh my, are you the good cholesterol or the bad kind? A lot of people are unfortunately very afraid of cholesterol. They should be probably far more afraid of inflammation, chronic inflammation. And here are some of the things that can trigger the free radicals. Free radicals are not a political group. Free radicals are unpaired electrons that can cause damage to various tissues and organs. And these are the triggers usually of inflammation: UV light, smog, airborne chemicals, tobacco smoke, diet, alcohol, drugs, sometimes excessive amounts of exercise, stress, and certain skincare and other cosmetics, or things that we use on a daily basis. What causes inflammation? Well, basically it comes down to daily living. So diet, sunlight, excessive worry, various pathogens, bacteria, parasites, fungi, candidiasis, cosmetic ingredients, and other chemicals. And one of the other things that can cause inflammation is vaccines. All vaccines cause inflammation and can alter the immune response, as you know. Vaccines can trigger allergies, autoimmune or neurological disorders, particularly in individuals genetically predisposed to being unable to resolve inflammation. Vaccines introduce large foreign protein molecules into your body and induce an inflammatory response to stimulate antibodies. Now, most of the medical profession believes this is a good thing. However, if your body responds to these foreign particles in a way that causes a type of inflammatory response that does not resolve, you can develop severe allergies, autoimmunity, or brain dysfunction. And there are probably numerous cases of this that you can look up on many websites around the internet. In 2011, the Institute of Medicine acknowledged there is individual susceptibility to adverse responses to vaccination involving unidentified genetic, biological, and environmental factors. So check your family history for evidence of allergy, autoimmunity, and neurological disorders, and carefully evaluate the potential individual risks of vaccination for you and your family. The flu vaccine may also pose an immediate risk to your cardiovascular system due to the fact that vaccination elicits an inflammatory response. One 2007 study published in Annals of Medicine concluded that, quote-unquote, abnormalities in arterial function and LDL oxidation, that's the bad cholesterol, may persist for at least 2 weeks after a slight inflammatory reaction induced by influenza vaccination. These could explain in part the earlier reported increase in cardiovascular risk during the first weeks after an acute inflammatory disorder. So that's one other thing to remember. The 5 cardinal signs of inflammation are redness, swelling, heat, pain, and a loss of function. And the 3 necessary events which leads to the cardinal signs are increase in blood flow, capillary leakage, and the leukocytes migrating from the blood to the tissues. So that's actually a good way of remembering it: heat, redness, swelling, pain, and loss of function. You can see the slide, something you can remember. The chemical mediators of inflammation include chemical substances synthesized or released, such as histamine, prostaglandins, and bradykinin. Bradykinin causes pain. Prostaglandins usually cause pain and fever, and histamine produced by the mast cells produces vasodilatation. So you can sometimes see that in cases of urticaria or hives. You have the vasodilatation causing redness. That's caused by histamine. And there are other mediators of the inflammatory response. I don't really want to get into too much detail here, but they include things like the complement system, serotonin, leukotrienes, which increase vascular permeability, and they increase the mobilization of endogenous mediators of inflammation, and prostaglandins, PGE2 and the PGE2 series. They increase vascular permeability, enhance pain-producing properties of bradykinin, and produce pain in general. So in general, when you have inflammation, you have several different potential outcomes. The first one is, if you look at the top of the slides, is resolution and the formation of fibrosis or scars. So at the end of inflammation or healing process, you get scars. Or you can develop, unfortunately, things like abscesses, ulcers, fistulas, and various sinus formations as a result of acute inflammation. Or it can become chronic. And chronic inflammation, you all may be well aware of, things like arthritis and colitis and all the other types of itis out there. Those are all chronic inflammatory processes. It appears your skin is inflamed. Use this ointment if it flares up again. Unfortunately, much of inflammation is in conventional medicine is dealt with very superficially. We use creams and ointments and potions to suppress inflammation. We use non-steroidal anti-inflammatory drugs. We use steroids. We use immunosuppressive drugs. All of those things work very well. Unfortunately, they're really just suppressing symptoms. Lymphatics in inflammation are responsible for draining the edema. Edema is an excessive fluid in the intestinal tissue or serous cavities, and it's either called a transudate or an exudate. And for inflammation to occur, minor damage occurs in 15 to 30 minutes. Severe damage can occur as early as a few minutes. The major local manifestations of acute inflammation compared to normal: vascular dilation and increased blood flow, extravasation and deposition of plasma fluid and proteins, and leukocyte emigration and accumulation at the site of the injury. So all of those things are occurring with an acute inflammatory response. Why on earth do they put arthritis pills in bottles we can't possibly open? So those are the four main mechanisms: vasodilatation, exudation, and edema, emigration of cells, and chemotaxis. That's the drawing or the magnetic drawing of various other agents. Okay. Why a little inflammation can be beneficial, severe or prolonged inflammation is not. In the process of inflammation, blood vessels dilate and become more permeable, thus enabling body defense cells and defense chemicals to leave the blood and enter the tissues. This is the body's first line of defense. This section of the inflammatory process is called leukocyte extravasation. And the immune system is something that identifies itself from non-self, and it identifies that which does not belong in the body. So the immune system is complex, it's dynamic, sophisticated system charged with protecting the body from that which is non-self, including pathogens, cells of diseases, and molecules of foreign particles. I want you all to remember this, because after this lecture there's a 600 question multiple choice examination you have to pass. This is actually a little bit beyond the scope of this lecture, but it will appear in one of my future books. So anyway, this is a little complex, but I'll get to the next slide in a second. Matrix metalloproteinases are triggered by inflammation, and they can flatten the dermis by destroying collagen, elastin, and other dermal tissues. So one of the effects of chronic inflammation is the production of these destructive proteins, and they can do a lot of damage to not only the skin but internal organs. And in order to determine whether you have inflammation, if you look at the bottom of the slide there, you can see the names of the tests that are used often by doctors to determine if you have inflammation. One of them is the erythrocyte sedimentation rate, or the ESR. If that's elevated, then usually that's a good sign of inflammation. C-reactive protein, CRP, and there's also another test called high sensitivity C-reactive protein. High levels of that have been associated with a greater risk of heart disease, and unfortunately it's also going to be positive in many other diseases involving inflammation. Circulating immune complex levels, those will occur whenever there's an exposure to antigens, or either to something that you're allergic to in terms of foods, chemicals, other toxins. The body will make antibodies, and these antibodies connect up with the antigens, forming what are called immune complexes. Cytokine levels will also be abnormal, and you may see abnormalities in the number of immunoglobulins. These are antibody families that are directed against specific antigens. And another thing that you might see, or you might want to test for, is something called fibrinogen. Fibrinogen is a protein that's involved in making the blood more sticky, and high levels are associated also with inflammation. We do a test called live cell microscopy at the office, and when we look at the blood, we look at a live cell, we could sometimes see high amounts of fibrin or fibrinogen in the blood field, and this makes the cells stick together much more. And so you get what's called rouleau formation. That's where the red cells are all stuck together and they're not freely floating. So that's another test that you can do. Still, let's do an X-ray just to be sure. Well, one of the things that triggers inflammation, acute inflammation and chronic inflammation, is something called free radicals. Free radicals are either an atom or a molecule with an unpaired electron. They're highly charged, unstable electrons looking to be at rest or looking for stability. They're looking to be quenched. They steal electrons from more stable molecules, setting off a chain reaction. And these unstable molecules that disrupt normal cell function by stealing electrons to gain molecular stability. Cell membranes, phospholipids are attacked because of their lipophilic nature, creating premature cell death. So in other words, these free radicals cause the basic damage that occurs to cells, tissues, and organs. And what are these free radicals? Well, in our environment, we have things like pesticides, microwave radiation, radiation of other types. Our metabolic process itself produces free radicals. Burnt foods, fried foods, rancid oils, trans fatty acids, hydrogenated oils, chemicals inhaled, all kinds of transdermal chemicals, nitrates, nitrites, additives, and preservatives in foods. What we have as a natural protection against these free radicals is what's called antioxidants. And antioxidants are any large class of substances that neutralize free radicals before they cause damage. And these are molecules that quench free radicals. They protect genes, they prevent aging, and they include basically various vitamins and plant compounds. So it's not just vitamins and minerals, but there's a lot of other antioxidants out there, both in our bodies as well as in the plant kingdom. They are usually coming from colorful fruits and vegetables, and they include things like lycopene, beta-carotene, various flavonoids, vitamin C, A, E, selenium, and glutathione. That's just to name a few. These are the immune cells that we were talking about earlier, monocytes, eosinophils. By the way, eosinophils, when they go very high in the blood, it's usually an indication of either allergies or parasites. There are natural killer cells, mast cells, which are the ones that secrete the histamine, basophils, neutrophils, and macrophages. Those are the ones that engulf the bacteria and other toxins. So phagocytes, they engulf foreign bodies. They digest via enzymes, peroxides, and respiratory bursts. Okay. Leukocytes, they're the primary immune cells. They migrate from blood to tissues, and they're the first immune response within the inflammatory cascade. And they're produced in the bone marrow, and they produce a lot of enzymes that can destroy invaders and can destroy various other toxins. Macrophages, that's what they look like. Immunity equals inflammation. Inflammation is an important process. We are exposed to so many different types of conditions that create inflammation. What do? We need to have tools to prevent and control low-grade subclinical inflammation. We have some choices. So the first thing I mentioned was detecting it, and there are various ways of knowing that you have inflammation. You can do a test for acid or alkalinity. The more acid you are, the more likely it is you have inflammation. Achy joints, they may be a sign of inflammatory process. Sinus problems, conditions where there's a lot of mucus in the system, in the bowels, for example. Laboratory testing like the high sensitivity C-reactive protein, the hsCRP, homocysteine blood levels, amino acid levels in the blood, the sedimentation rate, the ESR, lipoprotein A and other lipoprotein tests. If there are dilated capillaries, elevated blood sugar levels, food allergies, these are all signs that there may be a lot of inflammation going on. Elevated histamine levels, elevated toxic heavy metals like lead, mercury, cadmium, aluminum, arsenic, and so on. So some of the lifestyle changes that we can adopt, or what we can do about this, obviously we have to reduce stress. Exercise, an excellent way of reducing your risk of inflammation. Learn to be mindful, things like meditation, relaxation. There's many different approaches to this. Develop a relationship with your God. I guess that's one way. Prayer, meditation. Become more holistic in the way we think and approach ourselves and one another. And then, of course, there are dietary changes and supplementation. Conscious breathing, yoga, anything that improves breathing is very important. Our water consumption is important. Most people just don't drink enough water, and we've seen so many people get better by just increasing their intake of water. Proper elimination. It's very important to eliminate the waste material. If it accumulates, obviously, that's going to be something that's going to be an added stress to the body. Nasal irrigation is one way of improving sinuses as well as improving elimination of toxins. Decrease your acidic foods. And there are some supplements that I'm going to talk about later on. Anti-inflammatory food rules. Well, one of the most important things that you can do to reduce your risk of inflammation and to reverse chronic inflammation is to eat better. And there are certain foods that are pro-inflammatory and others that are more anti-inflammatory or less likely to produce inflammation. So with fruits, pretty much all of them are good except for oranges and some citrus fruits and fruits that you might be allergic to. The most beneficial ones are going to be apples, pineapples, cherries, papayas, pomegranates, raspberries, strawberries, and blueberries. And if they're organic, all the better. If they're not organic, it's important to wash them and get rid of all the pesticides and chemicals as much as you can. With vegetables, they're pretty much all very anti-inflammatory except for corn and cream vegetables. Kelp and other sea vegetables are allowed and encouraged, and also beneficial vegetables, spinach, celery, kale, and sweet potatoes are all excellent choices. All of those have antioxidants in them in high amounts and are very effective against inflammation. Now, the area where there's a big problem is with grains. Gluten-free grains are allowed, but you should avoid gluten. Gluten-free grains include brown rice, most cases oats, millet, quinoa, amaranth, teff, tapioca, buckwheat, and arrowroot. On the other hand, wheat, corn, barley, spelt, kamut, and rye must be avoided. They are higher in gluten and they are pro-inflammatory. There's a book on this which is quite interesting called Wheat Belly. How many of you heard of this? Everybody. Oh my God, I'm preaching to the converted here. Wheat Belly by William Davis discusses the impact of gluten in terms of inflammation as well as inducing more weight around the middle of the body. So if you happen to have a belly, maybe it's due to wheat or gluten. And unfortunately, most of the wheat that's available here in Canada is genetically modified, and so getting the kind of wheat that doesn't produce this kind of problem is extremely difficult. What comes with the steak? The answer is cancer, heart disease, and your choice of rice, pilaf, or a baked potato. That's another thing that we encourage people to reduce as much as possible is their intake of red meat. There's a lot of reasons for that, but you're probably better off with fish and seafood, chicken, turkey, wild game, and lamb. Unfortunately, beef, pork, cold cuts, hot dogs, sausages, eggs, and shellfish, those are much more pro-inflammatory. Legumes, all the beans are good except for soy. Lentils and peas are okay, but tofu, tempeh, soy milk, and anything made from soy is prohibited if you want to reduce inflammation. That's not to say that these are going to be inherently bad for you, but high intakes of those have been associated with more inflammation. Nuts and seeds, they're all allowed except for peanuts and peanut butter. There isn't a single peanut on the planet that isn't contaminated with mold, and a lot of people are very sensitive to peanuts. We're seeing much more of this, especially in young people, with them getting anaphylactic reactions. So peanuts are definitely a no-no. And dairy products, all cow's milk products are prohibited except for, well, they're all prohibited, including cream, yogurt, butter, and ice cream. On the other hand, rice milk, almond milk, oat milk, coconut milk, and other nut milks like hemp seed milk, these are all allowed. Just avoid soy milk. As far as oils are concerned, the best oils are cold-pressed olive oil, flaxseed, hemp, coconut, safflower, sunflower, sesame, walnut, pumpkin, and almond. Those are permitted, but I would avoid as much as possible margarine, hydrogenated oils, mayonnaise, and various other commercial spreads. The best beverages are water, herbal teas, soda or mineral water. Those are allowed, but I would avoid pop, diet soft drinks, alcoholic beverages, coffee, black tea, and caffeinated beverages. Those are not allowed. Do not underestimate the value of drinking adequate amounts of water, not only to help drive chemical reactions in the body, but also to flush out toxins. Spices and condiments. All spices are allowed except for chocolate, ketchup, mustard, relish, chutney, whatever that is, soy sauce, and barbecue sauce. The best anti-inflammatory spices are turmeric. We talked about this yesterday. Turmeric contains curcumin, which is one of the most powerful of all the antioxidant, anti-inflammatory supplements that you could find. Ginger, rosemary, and curry, these are all strongly anti-inflammatory, and adding them to your foods is probably a good idea. It'll help a great deal in any kind of chronic inflammatory condition, and probably also help with acute inflammation as well. The best sweeteners that are allowed are brown rice syrup, xylitol, blackstrap molasses, stevia, and agave. Those are all allowed, but avoid sugar, honey, corn syrup, candy, and other sweets. If any of you know what happens to kids after Halloween, you'll probably agree with me. If you want more information about diet, the best book I've ever seen on this is a book by Julie Daniluk, who was here earlier. She has a book out called Meals That Heal Inflammation. It's got a lot of recipes, meal plans, a lot of helpful suggestions on how to implement an anti-inflammatory program. So I think it's excellent if you can get a copy of that. That would surely help. While you're at it, would you pull out the sweet tooth? This person is seeing a holistic dentist. We had one on earlier, Dr. Sawiak, who's an excellent dentist, by the way. Okay, another way of looking at the same thing, reducing inflammation, is to increase alkalinity and decrease the acid-forming foods. So there are acid and alkaline-forming foods, and basically fruits and vegetables are eaten not only for their mineral and antioxidant content, but most have an alkalizing effect. Meats are more acidic, grains are more acidic, and in general, if you want to prevent inflammation, one of the best things you can do is try to split your diet 80% alkaline forming, 20% acid. And sugar is much more acid forming, and there's some evidence that the more acid you become, the more likely it is that you will increase your risk of cancer. Many nuts are acidic, but some are more alkaline. Healing foods, well tolerated by most, and these include Alaska salmon, herring, anchovies, sardines, tilapia, lake trout. One of the problems with seafood is the mercury content, and the larger the fish, the more mercury you will see. So try to eat mostly small fish, and probably not more than once every 2 weeks. Although I have, in my practice, seen quite a few people that do their mercury blood levels, and they don't eat very much fish. They eat sushi once or twice a week, and they have very high mercury levels. So it's important to know what your mercury level is, and then if it's fairly low, then probably you can get away with eating it once or twice a week. But small fish, stay with the small fish. Barley, oats, millet, quinoa, spelt, and brown rice, they seem to be tolerated by most people quite well. Flaxseed oils, olive oils, all the fruits except oranges, legumes, red, yellow, orange, and green vegetables. Those are all very high in antioxidants. As this slide says, it's good that you're eating more fruits, fresh fruit and vegetables, but be careful to chew more thoroughly. Some people are a little sensitive to fruits and vegetables. If they eat too many of them, they can get bowel problems. But most people tolerate them quite well, unless they have specific allergies. Reduce inflammation and you'll protect your genes. So you want to make good choices in water, tea, medicinal mushrooms. You want to eat more colorful fruits and vegetables, mostly organic. You want to stay away from GMO foods, even though the government seems to be very protective of GMO foods. And I think there's a growing movement towards having better labeling of foods so that we know which foods are GMO and which aren't. And if you're going to eat animal proteins, make sure they're free-range meats. And obviously you want to reduce your sugar, salt, and processed food intake. Avoid fried foods. Try to eat mostly organic dairy products if you can. And the best nuts, macadamia and walnuts, those are probably the best. That inflammation is caused by splinters, Mr. Jenkins. I'd recommend switching to a diet of softer woods, say pine or cedar. Sometimes if we eat too much fiber, it could be too irritating, and there are some people that have a problem with certain types of fiber, so there's quite a large selection of fibers that you can choose. I prefer that people use more of the soluble fibers like psyllium, flax, guar, glucomannan, those kind of fibers, apopectin, and so on. Those are probably the most easily tolerated. Rules for anti-inflammatory eating: eat selectively, watch portion sizes, eat smaller nutritious meals more frequently, don't chew on the run. Choose tan or brown carbohydrates, not white ones. Grains, seeds, and nuts. Emphasize protein, lean and combined vegetable sources. Eat protein foods first, followed by non-starchy vegetables, then carbos. Those are based on food combining rules, and not everyone has to follow those. If you have problems with digestion, or if you have a lot of problems with elimination, it's probably very important that you take a look at those food combining rules, but not everybody has to do that. Drink plenty of liquids between meals instead of with the meal. No soda, although there are some people that do extremely well with soda water, like plain soda water. Plain soda water is high in alkaline forming minerals, and as a result of that, most people can tolerate them quite well. If you drink alcohol, drink with the meal and moderately. Probably red or white wine would be acceptable. Beer and other spirits, they're probably much more difficult to process, and they increase the yeast population. Choose seasonal fruits and vegetables with the most intense colors. Use high quality oils. Avoid unhealthy fats. Eat meals at regular times and do not eat late. The later you eat, the more you pay for it. Avoid processed foods and choose low-fat dairy products if you're going to have any at all. Phytonutrients. Well, that's a new buzzword among food scientists. These are amazing plant chemicals that are primarily antioxidants, and they're found as pigments that give plants their vibrant color. And they help neutralize free radicals and inflammation. They prevent cancer, and they also help repair genes. So they kind of look like this. You've probably seen them in the grocery stores. The yellow, orange, and bright red ones contain a lot of what are called carotenoids, beta-carotene, and lycopene. And many of you have probably heard that those are very effective in preventing or even in treating cancers. The green ones have a lot of sulfur compounds: sulforaphane, isothiocyanates, indoles, and R-alpha-lipoic acid. Those are strong antioxidants. The purple ones, blue ones, black, and magenta ones, they're high in phenolics or flavonoids. And the tan ones are high in phytosterols, phytoestrogens, and fiber. The phytoestrogens that we're talking about, these are the ones that are like adaptogens. If your estrogen levels are too high, they help bring them down. If they're too low, they bring them up. So they're kind of like ideal to use or to consume during the menopause or premenopause. The white ones, the white types of plants, they contain mostly protein, omega-3 fatty acids, and omega-6 fatty acids, although too much omega-6 is probably not a good idea. So orange, red, yellow, green, those would be carrots, pumpkins, peppers, tomatoes, mangoes, and papaya. And they protect the genes. The green ones, asparagus, broccoli, bok choy, green onions, mustard greens, they help repair genes, improve cellular nutrients, and also help with detoxification. Especially onions. Onions I found personally to be very effective in treating a cold or a flu or any kind of infection. They seem to make a big difference in terms of their antibiotic properties. And the purple, black, blue, magenta ones, the blackberries, cherries, beets, they help reduce inflammation too. Tan, brown, like barley, mushrooms, tofu, and wild rice, they reduce insulin resistance, and they help balance hormones. And I mentioned the herbs and spices before that you can use, things like garlic, onions, tea, cinnamon, turmeric, which contains curcumin, curry, ginger, ashwagandha, desmodium, cardamom, and cayenne. Those are all free radical scavengers. So this is one of the basic things that you should know. All anti-inflammatory supplements are antioxidants as well. One of the most powerful ones, which is curcumin, is not only a very strong anti-inflammatory, but it's one of the strongest antioxidants that protect the liver. So if you have any liver damage or you have any liver stress, curcumin is probably one of the best ones that you can use. So if you have an anti-inflammatory, you also have an antioxidant, and vice versa. Documented studies show a clear connection between higher blood levels of certain nutrients and a lower risk of many health conditions and diseases. So a lot of people are wondering, well, if you eat perfectly and you're eating organic foods and you never eat anything that's really prohibited, then why would you need supplementation? Well, supplementation is important for several reasons. Isolated molecules from foods delivering dosages much higher than we could possibly obtain from food. So some people, despite the fact that they may be following an almost perfect diet, they may develop various inflammatory conditions which will respond to much higher doses of the same antioxidants from an external source, from capsules or from a liquid source. Targeted supplementation, what is specifically being treated? So there are some antioxidants that are better than others for certain conditions. So for example, people that have eye conditions, you're much better to get the antioxidants from blueberries or bilberries and from vitamin C containing foods than you would be from other sources. They reduce inflammation, stop pain, stop and slow down disease progression. So the more you use of these, the more likely it is that you're going to reverse the disease. General supplementation, overall prevention and reduction of inflammation is possible. Oftentimes people, even though with the best intentions, still have poor eating habits, and due to stress or whatever reason, they may not be eating well at any given time. So for them, supplementation may be much more important. And it's been often said that we cannot consume the amount of food necessary for today's world. So with all the pollution, all the stress, all the chemicals, all the radiation that's out there, we would need more than the protection that we can derive from foods alone. So that's one of the other reasons why we may need supplementation. We need to replace micronutrients to protect our cells. We may just not be getting enough from foods. Foods these days, unless it's organic and unless you're very wealthy, you're not going to be able to afford to get the best food at all times. So supplementation is probably a great idea. So what are these supplements that we can use? Well, high quality multiple vitamin and mineral supplement is probably a great idea. Folic acid, B vitamins, vitamin D, C, A, and E, I think those are pretty basic. If you can also get in there bioflavonoids like quercetin, pycnogenol, boswellia, bromelain, these are all anti-inflammatory agents. There are various herbs like devil's claw, white willow bark, S-adenosylmethionine, that's also known as SAMe. Feverfew, fish oils. Fish oils made up mainly of DHA and EPA, I'll talk about that later. Ginger. Ginger is one of the most wonderful herbs that you can add to your foods. You have chronic anti-inflammatory protection at all times. You just add ginger, curcumin, or turmeric to your foods, maybe even some curry. Also, there are supplements like glucosamine, trimethylglycine, coenzyme Q10, alpha-lipoic acid, and glutathione. I'll get to those in a minute. So antioxidation equals detoxification. So if you get enough antioxidants, you're going to be able to rid your body of free radicals much more quickly. You can increase the detoxification. That's something that's always worthwhile doing on an ongoing basis. Your body does not make vitamin C. Linus Pauling wrote several books on this fact that we need to supplement vitamin C because our bodies just don't make it in response to stress. I think only the guinea pig makes vitamin C in response to stress and can make as much as 60 grams a day. We don't manufacture any. They make it from glucose. We have to supplement it in order to maintain our ability to resist stress and inflammation. Glutathione is one of the body's main antioxidants. It's incredibly important for the nervous system. There are now all kinds of studies that show that if you get adequate amounts of glutathione into the brain, that you can help reverse conditions like Parkinson's disease, you can improve symptoms of MS, dementia, Alzheimer's, and many other neurological conditions. Alpha-lipoic acid, incredibly important for detoxifying the liver, also very important for controlling blood sugar levels. And if you remember what I said before about blood sugar, if your blood sugar is out of control, it produces far more acidity. So the more sugar you consume, the more you're going to end up with problems with either abnormally high or low blood sugar levels. Alpha-lipoic acid is something that maintains those sugar levels at a fairly normal level. Acetyl-L-carnitine, that's an amino acid that's very important for helping brain function, improving the functioning of memory and thinking. And it's also important as well to clear out excessive fat from the liver. So that's another way of producing anti-inflammatory effects. And once again, vitamins A, C, E, and something called tocotrienols. Tocotrienols are usually found in what's called the vitamin E complex. So when you take vitamin E, I think it's very important to take the vitamin E complex. That's a complex of alpha, gamma, beta, and so on. And they also contain tocotrienols. And these are very strong antioxidants. They protect against lipid membrane peroxidation. They definitely lower the risk of heart disease. They improve insulin action, especially those in diabetes. They do reduce inflammation, and they improve the immune response. They protect against exercise-induced oxidative damage. One of the problems with too much exercise is producing more oxidative damage. So if you took vitamins A, C, E, and tocotrienols, that would help reduce that. They also inhibit protein glycation, which is one of the measures of aging. And also there's another bioflavonoid called pycnogenol. That's an effective anti-inflammatory agent, as is green tea. So those are all very important for reducing inflammation. And then, of course, there are things like sulfur-containing antioxidants, indole and thiosulfonate compounds. Many of you have heard of indole 3-carbinol, or DIM, which protects against prostate, cervical, colon, and breast cancer. Aged garlic, that's another one, another food that you can be using. That it inhibits TNF-alpha and NF-kappa B, preventing damage to the DNA and reducing inflammation. Coenzyme Q10. Somebody asked a question earlier about what to do with the damaging effects of statin drugs on the muscle. And one of the things that you could use is coenzyme Q10, because statin drugs basically destroy the body's ability to make coenzyme Q10, and it produces a coenzyme Q10 deficiency. That in turn leads to muscle damage and damage to the heart. So coenzyme Q10 is one of the things that you can use to reverse some of that damage. Coenzyme Q10 is known as ubiquinone, and it's concentrated within the mitochondria as part of the ATP producing apparatus in a plant. In humans, all aging conditions result from mitochondrial dysfunction due in part to insufficient coenzyme Q10 levels. Coenzyme Q10 is found in all living species, and it must be supplemented with any heart medications, especially statins, but also beta blockers and other cardiac drugs. And coenzyme Q10 decreases with age, so the older you get, the lower your CoQ10, the more the aging can occur. Clinical trials of CoQ10 show that they inhibit lipid peroxidation of both cell membranes and low-density lipoproteins and protect DNA from oxidative stress. They prevent oxidative stress to the brain, and they enhance speed of recovery and cardiac function from heart attacks. So if you've had a heart attack, one of the most important things you can take is coenzyme Q10. It maintains healthy apoptosis, which is also known as programmed cell death, and may prevent cancer. So coenzyme Q10, they did a study a few years ago that showed that if you took 400 milligrams of CoQ10 a day, that this had a reversing effect against one particular type of cancer known as breast cancer. It also seems to prevent thyroid disorders. Alpha-lipoic acid, I mentioned before, both water and lipid soluble, and making it a universal antioxidant that provides protections throughout the whole body. It restores vitamin C, E, and CoQ10 to full scavenger capacity. So in other words, it recycles it so that it can be used over and over again. It protects DNA by sequestering free radical generating metals, improves carbohydrate metabolism, and improves brain energy and musculoskeletal performance. And new research has shown that vinpocetine, a derivative of vincamine from the periwinkle plant, inhibits pro-inflammatory mediators in endothelial, epithelial, and macrophages, showing promise for the treatment of chronic inflammatory diseases such as atherosclerosis, chronic obstructive lung disease, arthritis, infectious disease, cancer, but especially Alzheimer's. So this is one of the things that may improve memory, vinpocetine. I think it's something you can get from your health food store. And then there's DHA and EPA. Docosahexaenoic acid, or DHA, is a fraction of fish oil, which is an effective non-prescription supplement that suppresses pro-inflammatory cytokines. Gamma-linolenic acid, or GLA, is another anti-inflammatory agent. DHEA is shown to suppress interleukin-6 as an inflammatory cytokine. Nettle leaf also suppresses cytokines. And N-acetylcysteine, which is an amino acid also known as NAC, it will also be a protective antioxidant. And so will vitamin K. We talked a lot about vitamin D, but vitamin D and vitamin K seem to work together to reduce inflammation. Omega-3 fatty acids, the DHA and EPA. Omega-3 fatty acids are polyunsaturated, and they include ALA, or alpha-linolenic acid, eicosapentaenoic acid, or EPA, and docosahexaenoic acid, DHA. And one of the problems with these is that they have to be made in the human body from other food sources. Humans can synthesize other omega-3 fatty acids from ALA, and these two, the EPA and DHA, are usually referred to as marine-derived, and because they are abundant in certain species of fish. In order for us to make that in our bodies, we have to get it from an external source, either from fish, or our bodies have to make it from ALA, which is things like flaxseed, walnuts, soy, walnuts, olive oil, and broccoli. Or these are some of the EPA and DHA sources. If you want to eat fish, you can get it from herring, salmon, oysters, trout. Those are the best sources. DHA is found in very high concentrations in the cell membranes of the retina. It conserves and recycles DHA even when omega-3 fatty acid intake is low. Studies in animals indicate that DHA is required for the normal development and function of the retina. So if any of you have inflammatory eye problems, that's one of the supplements that you may want to consider taking. Coronary artery disease, for the most part, is prevented by fish consumption. One study showed 1,822 men for 30 years. They followed 1,822 men for 30 years and found that mortality from coronary heart disease was 38% lower in the men who consumed an average of at least 35 grams, that's 1.2 ounces, of fish daily, than men who did not eat fish, while mortality from myocardial infarction or heart attacks was 67% lower. So there are a number of studies that show a definite lowering of your risk for heart disease if you consume adequate amounts of omega-3. There have been several randomized placebo-controlled trials, and even the American Heart Association has recommended that individuals with documented coronary heart disease consume at least 1 gram per day of EPA and DHA. Several studies have found an inverse correlation or relationship between fish consumption and sudden cardiac death. In a prospective study, omega-3 fatty acid intake was equivalent to 2 fatty fish meals per week. They were associated with a 50% decrease in the risk of primary cardiac arrest, so that's pretty significant. Large doses of fish oil are very good for your heart, especially when you get the urge to swim upstream. So there are many companies that manufacture omega-3. This is one of them, TriStar Naturals, but there's many other companies that also produce it, so I'm not going to favor this one, although this is one of the ones I helped formulate. Inflammatory diseases like rheumatoid arthritis. Studies have been conducted to determine the effects of omega-3 fatty acids on rheumatoid arthritis, and clinical benefits were observed at a minimum dose of 3 grams per day of a combination of EPA and DHA, and were not apparent until at least 12 weeks of supplementation. So if you take fish oils for 2 or 3 days and don't get a good result with your arthritis, please don't give up. You've got at least 12 weeks to see whether or not it's going to make a difference for you. Some investigators report that patients taking omega-3 fatty acid supplements were able to lower their doses of non-steroidal anti-inflammatory drugs. Those are known as NSAIDs, or as Dr. Alan Gaby likes to say, new sorts of aspirin in disguises. But not all findings on this issue were consistent. Also, omega-3 fatty acids or fish oils have been found to be effective for many cases of inflammatory bowel disease, that's ulcerative colitis and Crohn's disease. Clinical trial results were less consistent with inflammatory bowel disease than in patients with rheumatoid arthritis, but I have found quite a few of them in my own practice who have benefited from these oils. There have been some randomized trials of this, and they have reported in ulcerative colitis significant improvement. Clearing out inflammation. All right. I'm going to skip a few slides here. One of the things that seems to be very beneficial in clearing out inflammation that is not too well known in North America is serrapeptase. How many here have heard of serrapeptase? Oh, quite a few. Okay. Serrapeptase is an enzyme that clears away when you take it on an empty stomach. 5 minutes. Okay. When you take serrapeptase on an empty stomach, it tends to clear away dead tissue, blood clots, cysts, arterial plaques. In fact, in Germany and in many clinics in Europe, they use this in preference to EDTA chelation treatment to clear arteries. So this is something that will help dissolve some of the debris that's in arterial plaques. It also helps dissolve scar tissue, and it seems to make a huge difference in clearing mucus from the body. So it is very anti-inflammatory, and it's relatively inexpensive.
What name brand can we buy?
What name brand? There's many. There's TriStar. There's also Enerex. Those are the two companies that have one. I'm not aware of any other people having it. Then there are many American brands you can get over the internet. Natural Factors, I'm not sure if they make one or not. They do? Okay. Natural Factors is another brand. So you can find this in your health food store. Serrapeptase, many clinical applications: arthritis, bursitis, tendinitis, fibrocystic breast disease, carpal tunnel syndrome, atherosclerosis, chronic sinusitis. It improves the elimination of bronchopulmonary secretions. It's very good for traumatic injuries. So if you've had an injury, that's one of the things that you can take. Now, I know there's quite a few other things like Traumeel and bromelain and so on. But in the past few years, what I've noticed to be the most effective is serrapeptase. Post-operative inflammation. It facilitates the therapeutic effect of antibiotics in the treatment of infections. And also there is some evidence that serrapeptase can cleave off some of the protective protein layer that cancer cells have and allow almost any kind of cancer therapy to work better. So it's something that can be used as an adjunctive for many different conditions. The poor monkey on the right is saying bursitis. I guess you don't get it. I'm sorry. Vitamin D, a few words about vitamin D. Vitamin D is anti-inflammatory. If you have any kind of itis, low levels of vitamin D will contribute to greater inflammatory responses. So it's important to get your vitamin D blood level checked just to make sure that that's something that you can quickly correct. That's my book on vitamin D. If you want to get more information about it, Vitamin D, the sunshine vitamin, for people that do not live in very sunny places. There's a lot of information in there about how to supplement vitamin D. Insufficient vitamin D levels are associated with knee arthritis. This is from November the 9th, 2012, from the journal Arthritis Care and Research. And it showed that vitamin D has a protective effect if you have increased levels against knee osteoarthritis. And this is something that's greater in African Americans than those of European ancestry. People with darker skin have a great deal more difficulty in manufacturing vitamin D under their skin, and as a result of that, oftentimes their blood levels are significantly lower. The lower their blood levels, the worse their osteoarthritis becomes. Now, I know there's many good things for osteoarthritis, including glucosamine, chondroitin, boswellia, and so on, but if your vitamin D blood levels are low, none of those things are really going to help you, so it's important to get your blood levels checked. Ask your doctor to check for 25-hydroxy vitamin D, and that's going to tell you how much of vitamin D supplementation you may need, especially if you live in Toronto. Don't talk to me about joint pain. See, some people have more joints than others. Any free radical infestation will create low-grade subclinical chronic inflammation, which needs to be controlled. So one of the things that's recommended for that is vitamin C powder. Also, we've talked a little bit about glutathione, alpha-lipoic acid, and drinking more water. Any free radical infestation will cause inflammation. This is something on arthritis. And then I would like to conclude with one very important thing that has occurred in the past few months. And one of the reasons why I've become a little bit more active in speaking, which I haven't done very much of in the past few years, is the fact that Health Canada is pretty much on a rampage against this kind of medicine and against people taking nutritional supplements. And this slide shows a slide of Harlan Lati, one of my old friends from the 1980s and 1990s. He's the owner of Finlandia Natural Pharmacy and Healthcare Center, and his pharmacy was raided by Health Canada. His health pharmacy was raided because he was selling something called nattokinase. Nattokinase is another soy-based supplement enzyme which is used by a lot of people to help thin the blood. So if you don't want to take Coumadin or Pradax or one of these other drugs that can kill you, and you want to take nattokinase, you are not allowed to do so. In Canada, this is going to be banned. And it may come back at some point as a prescription, but one of the things that I'm really fighting against is this kind of indiscriminate bias against natural medicine, which has no scientific validity and is strictly and only a political effort. That's what it is. So pretty soon all the health food stores will be carrying this, which is a postcard, which is something that you can sign. Second page will include this statement, which is basically saying that, you know, why are genetically modified foods and drugs that can kill you and tobacco and cigarettes and all of these harmful things totally illegal in Canada, requiring no prescriptions, and are able to kill off as many people as they want to, allowed to be on the market without any kind of responsibility or accountability, and at the same time we're not allowed to use nattokinase, which hasn't killed a single soul. So what I'd like to encourage you to do when you see this in your health food stores is to fill out a card and send it to your member of parliament and ask him if he or she wants your vote. Because in the end, that's the only thing they ever listen to is who votes for them. They don't care about anything else. They only care about who votes for them. Anyway, just to finish off here, these are some of the drugs. If you take a look at these are the ones that are commonly used. Some of them are over-the-counter, some of them are prescription. We're looking at Tylenol, aspirin, Excedrin, Ansaid, Advil, Motrin, Orudis, Feldene, Vioxx, Celebrex, and so on. All of these are drugs that, for the most part, are available. But the risk of dying from these is like 1 in 1,200. So gastrointestinal bleeding and perforation are not the only potential hazards of NSAID use. The guidelines warn that high doses of acetaminophen, which is another NSAID, that's Tylenol for all of you who don't know, can lead to liver damage, and massive single doses sometimes lead to fatal hepatic necrosis. The number one reason why people get liver transplants in North America is Tylenol overdose. So we're not talking about very safe and effective drugs here that are harmless. We're talking about things that potentially can hurt you, yet they remain on the market, usually without prescription. These are some startling statistics. These are the number of deaths per year from different conditions. From leukemia, 20,197. From AIDS, 16,685. From NSAID toxicity, 16,500. So we're talking here about some pretty serious side effects. And yet these are on the market free, without any kind of real regulation or without any kind of accountability. So choose your expensive urine. You can choose the natural or you can choose the synthetic. I think we should be given a free choice, and I think if we are given a free choice, I think that's only fair. Thank you for your kind attention. If you have any questions?
Earlier on, you had stated that you should consume vitamin C powder. I was told that ascorbic acid powder, vitamin C powder, is dangerous to our intestinal organs and is far too acidic. Is that true? And if it is so, what would you advise to be the best type of vitamin C?
Well, it's true that there are some people that are sensitive to different forms of vitamin C. I don't recommend vitamin C because the Vitamin C Foundation doesn't recommend it. And most of the research that Pauling did and other people did on vitamin C was done with pure ascorbic acid. Now, in general, most people tolerate it quite well. And I suggest that people start with low doses, like 1,000 milligrams a day, and gradually build up to what their bowel tolerance is. So the usual way of doing that is increase it by 1,000 milligrams a day until you get loose bowel movements, and then back off a little bit. That's the best way of doing it. Yes? Fluoride in the water, well, there's all kinds of evidence that it's damaging. It can damage enzyme systems, create all kinds of other horrible conditions. But this is, once again, another political thing. It's not based on science. And one of my big beefs is that, why don't you base decisions on science and not on politics? And unfortunately, most of our decisions in healthcare are based on politics. Yes? I think citrate is probably the best absorbed. Now, for some minerals like magnesium, it's better to get glycinate because then you don't get the loose bowel movements with it. But each mineral is probably best absorbed in the citrate form. Yes?
In terms of vitamin D, I know Health Canada still recommends only 1,000, and the American is even 400. But I know you're very strong on it. Taking 7,000 or 8,000 international units a day a problem?
700 or 800?
1,000.
I've never seen it to be a problem. Dr. Weith at the University of Toronto, he says he's never seen a single side effect or serious problem associated with anything 10,000 international units per day or less. So he's the top researcher in the world. So vitamin D, 10,000 vitamin D or less a day. Yes? If the white cells are low, sometimes that's due to an infection with usually a virus, or it can be also due to severe stress. So there's all kinds of ways of boosting that up. Vitamin C and bioflavonoids are one of the main ones. But in some people, that doesn't seem to work. You have to use also things like probiotics or maybe colostrum, and in some cases, intravenous vitamins as well.